Hi, I'm Sarah DeBoer, physiotherapist here at PhysioPlus Health Group. I'm just going to take a minute to tell you a little bit about a modality that we have here called Shockwave. Shockwave is a common modality used in physiotherapy and has been used successfully for the treatment of orthopedic conditions for over 20 years. So how does it work? So Shockwave is exactly that. It's a wave of pressure that comes out of the end and is sent into your tissue. It causes changes that are thermal, so it has a little bit of warming, and there's also a mechanical impact. This is good because it increases the circulation and the nutrition that's getting to the area, and the physical effect of the shockwave is also able to break down tissues that need to be broken down. What does it actually feel like to receive shockwave therapy? So the shockwave machine is put on your skin, and you're going to feel that pressure wave or that tapping going into your skin. Some people report some pain, so think if you have an injury that's really close to the surface or it's really tender to the touch, then the shockwave can be a little bit painful. However, some people report no pain at all, which leads to another question of how often am I going to have this done? So shockwave is like a prescription of another medication. It's important that we get a certain dose based on the injury and that it's prescribed at regular intervals. The most common would be once a week for about 4 weeks. So a common question that we get is that, do I do shockwave on its own or is that part of a treatment plan? So while shockwave is a great way for us to get in and trigger healing in our tissues, it's important that we do it alongside some other pieces that are important in a treatment plan. So when we look at a whole treatment plan, once that tissue is healed, we want to make sure that we're strengthening and correcting any issues that led to the problem in the first place. So for example, if you have an issue with your Achilles tendon down at your ankle, we want to make sure that we're not only improving the tendon, but then we're strengthening the calf and maybe even prescribing something like an orthotic that's going to correct the issue that led to the problem in the first place. Is shockwave right for you? Shockwave is used to treat a number of different conditions, whether it's the bone, the muscle, the ligament, or the tendon. A lot of research backs up the benefits in helping you heal better and faster. Some common conditions you might have heard of include plantar fasciitis, tennis elbow, Achilles tendinopathy, and a lot of stuff that goes on in the shoulder or your rotator cuff. So while shockwave is a common modality, not all physiotherapy clinics have it. Luckily here at PhysioPlus, we are fortunate enough to have the machine and be able to provide this service for any patient that we think is appropriate. Are you wondering if that's you? Feel free to contact the clinic for a free complimentary call with one of our therapists. We'll be able to ask you questions and find out if this is the right modality for your injury.